And welcome back to the Factor Uncensored as we continue to recognize the 3-year anniversary of COVID-19. Now, there's some good news out there when it comes to COVID-19. Harris County is averaging 245 new COVID cases a day. That's a major drop in the number of cases we have seen in the past and a big improvement. We were seeing thousands of new cases earlier this year and throughout the pandemic. Dr. Danish Ali from Archpoint Pain Institute joins us here with more on this update. And how have things changed over the last 3 years in your industry as a result of COVID-19?
Isaiah, what we've seen is a decrease in the number of folks visiting doctors unless they're really sick. We have seen an increase in hospitalizations, right? And as a result of folks who, may be putting off getting checked out by their primary doctors or going in for their wellness checks. And so we've seen a significant decrease in that. And numbers are now kind of improving a little bit, but, I still want to urge our community folks and our audience to consider getting checked out with an annual exam, a wellness check, all of those things that you may have been putting off for a few years as a result of COVID. I think it's time to reopen those chapters and discuss that with your doctors.
Now, for many people, things are back to normal and they're going about their life as if nothing happened, but we're approaching spring break. And every time there's a holiday and people are out and about, we see a slight increase, right?
That is correct, Isaiah. We were just looking at the trends earlier today, and with holidays, let's just go back to New Year's. We saw a significant increase in the number of hospitalizations as well as an increase in the number of cases. The hospitalizations didn't increase too much, but the cases definitely did, which tells us that the folks were getting infected at that time. It was going around. We do know historically that there's an increase in the wintertime. However, anytime there's a large gathering or folks getting together, or there's holidays, we do see an increase. And so, again, the message is similar in the case that if you feel ill, there are home tests you can do. There are still pharmacies. There's still different places where you can get checked to see if you have COVID, and just take the appropriate precautions if you are not feeling well.
And it's still almost kind of jarring to me, but people still haven't given up. Some people haven't given up their face coverings, their masks, and they're still wearing them today. Would you advise that, or is it just a personal option or choice that you make?
Right, Isaiah. So the thing is, it all depends on, do you have other risk factors? Some of these folks may be a little bit older. They may have other medical comorbidities like diabetes, high blood pressure, other things that may make their immune system not as efficient ability to fight the infection. And so, yes, those people should be taking appropriate precautions. If you're around, if you're a bus driver and maybe you're interacting with a lot of folks throughout the day, or, etc. I think it behooves you to continue to wear that if you're around a lot of people, because again, it only takes one case, one illness, one person to affect you and infect you. And so that's why it's appropriate still to consider those depending on your risk factors, depending on your personal beliefs, and depending on when you were last vaccinated.